with us. If not, please do register and start using this service. So that is, Meradoc in a nutshell. So moving on to the topic of the webinar today, which is Omicron. So, just a few questions that I have listed here that we hopefully will answer by the end of the session. So first of all, what is Omicron? Some people have asked us, कि पहले corona था, अब Omicron आ गया. Like, are they separate things? Are they the same thing? So Omicron is a variant of COVID-19. Like there was Delta, we have Omicron. How they differ is in terms of, mutations, small changes on the surface of the virus. It is something very technical, but these small mutations are what make, coronaviruses specifically very difficult to treat because they keep on changing. You try and formulate a cure for one, suddenly you find something else entirely is there. So Omicron was first discovered in Africa, more specifically in South Africa, late last year in December, and immediately it was classified as a variant of concern. What that means basically is a variant which has a tendency or a propensity to, have a higher rate of transmission than the normal virus was. So that is why it was marked as a variant of concern. And very soon it has, spread all over the world. It started off with just Africa, but now I hardly believe that there are any country in the world that do not have an Omicron case. It has overtaken Delta tremendously. So wherein in the early days in India, it was like one Omicron case to maybe 60 or 70 Delta cases. Now it's the other way around. You have 10 cases of the Delta variant to 90 cases of Omicron. So why it has spread so much? Again, this is due to the technical buildup of the variant. So Omicron is very transmissible. Due to the lesser severity and number of symptoms, people often don't know. Mostly they may be asymptomatic, so they don't know that they're carrying the virus, and hence they are more liable to transmit it. So if I'm, as you are all aware, post Diwali last year, everyone started to return towards a sense of normalcy. We started relaxing the COVID norms. We started becoming lax in, masks, hand sanitization, and all that. So that helped this virus grow and, multiply amongst the population. And till now, we are in a state of community spread that, Omicron can just spread through the air. You don't need to have a contact, or people generally can't understand where they're getting it from. They may not have contact, they may not have been going out, but you can just say it's sort of in the air now, and very difficult to protect yourself from it. Having said that, how do we take care of ourselves? How do we protect, So first and foremost are masks. So masking up is the way to go. However, some learning on that, wherein we used to wear, for Delta and the other variants, we used to say that a cloth mask or a very simple mask is very good enough to prevent, transmission of COVID. In Omicron, what we have seen is you require a minimum of a 3 to 5 layer surgical mask, or the best option in the market today is an N95 respirator, something like this mask that I wear on a daily basis. It was very tough in the early days to get hold of such masks. Even we used to pay, as doctors, we had to pay an arm and a leg, upwards of 500 rupees a mask. But I'm happy to say now that they are very easily available. You just go to an Amazon or a Flipkart and download it, order it, and you'll get it at home. So availability and pricing have become much more accessible right now. Coming to what Omicron is all about, how do you know if you have Omicron? What are the signs and symptoms of Omicron? So compared to Delta, what we have seen is people with Omicron present with high fever, and a large volume of patients, around 70%, present with very high body ache. You don't feel like getting out of bed. You have fever of 100, 102. You may be popping paracetamol, Dolo. We've seen all the memes about Dolo right now, the miracle drug for treatment. So, but despite having all the paracetamol medications, sometimes the fever is not breaking. That is something new which we have seen with Omicron. So fever generally persists for 2 to 3 days. Body ache, general weakness, persists for up to 5 to 7 days. And you may or may not develop cough. So because large percentage of the population in India has been vaccinated, That has helped to an extent to mitigate the symptoms. The severity has gone down, but that does not mean that it becomes less contagious or you are safe from the virus if you've been vaccinated. So you can say the symptoms are similar to a flu, but you have to take extra precautions. You have to be extra wary, especially if you have some comorbidities, or someone in your house has comorbidities. So something like a simple diabetes or a hypertension, the virus, the way it interacts with the body, the way it changes the electrolyte imbalance. Omicron, we have seen it increases the potassium levels in the blood, so that causes all the muscle pain. And then it's a vicious cycle. It increases your blood sugars, it causes high heart rate, palpitations are there. So you have to take care, especially people with comorbidities. So it may present like a mild flu, but especially among the elderly and the children, the symptoms are far more severe that we have seen. So it is very imperative that we take the precautions. Coming to the testing modalities remain the same. One interesting point that we have noted is that more and more people are testing positive in the rapid antigen tests as compared to Delta. This may be because the virus is multiplying more in the upper airway as compared to Delta, which is why we have seen that lesser patients are developing symptoms in the lungs. So rapid antigen test, it is the same sample collection as a RT-PCR, but we are doing it at home, and the convenience is there. So a rapid antigen works just as well as a RT-PCR test detection. However, if you do have symptoms and test negative on a rapid antigen, I would strongly suggest you get a RT-PCR done just in case, because the accuracy levels vary significantly. And rapid antigen has just about 30 to 40% accuracy. RT-PCR at upwards of 90. So that is why that is the gold standard right now for diagnosing. But having said that, based on the evidence we have seen, people are testing positive on rapid antigen kits, which are available at pharmacies. They don't cost a whole lot of money, anywhere from 200 to 500 rupees. So you can test it out. Now, coming to the vaccines, this has been a very contentious point of discussion all over the globe. One dose, two dose, a booster dose. Do vaccines actually help? And the answer from me would be a overwhelming yes. Vaccines do help. What we have seen clinically, they may not prevent you from getting the disease, but they reduce the severity of symptoms by 90%. And in healthy individuals, all the studies that have happened so far have told us that they reduce the chances of deaths in healthy individuals by up to 100%. So we're talking about reduction in mortality of close to 100% if you are fully vaccinated. Now, people in all parts of the world, we have seen that people are hesitant to get vaccinated. They're worried about the side effects. But even in India now, it started off with the US when they gave proper vaccine rights to Pfizer and Moderna. So they have passed all the clinical trials after emergency authorization. They have gotten proper authorization. And just a few days ago in India as well, Covishield and Covaxin, the two vaccines that we started off with, they have now received proper authorization, which means that they have been tested and found to be safe. So they are no longer under experimental or a trial phase. So these vaccines do work. I strongly suggest anyone who is eligible to get vaccinated, please go and get it done. Uh, Now coming to the children part of it, there was a big hue and cry last time in July, August that, when the third wave will come, it will affect the children the most. In a way, that statement is coming true, because how it has happened is children are the only population that have been given the vaccine yet. While we have started with children aged 15 to 18, they have been started getting, and we have got good response from them. I mean, I believe that within Delhi, we have got 90% of the children who are eligible have already gotten their doses. So children are more susceptible right now because they are the largest population that is unvaccinated. So they are getting COVID, they are getting symptoms, and because they have not been vaccinated, the symptoms is slightly higher. But the ability of children's bodies to heal faster, fight off diseases better, uh, mitigates this to an extent. But still, the number of children who have been hospitalized, we have seen a huge increase in number of pediatric hospitalizations for COVID. Fortunately, none very seriously. I would not say none, but a very few small number which have taken to an ICU or have been having severe disease. But still, children and those with comorbidities and the elderly are the most vulnerable population right now that we have. Now, coming to, there's been again a lot of discussion in European countries that, they have started opening up. They have said, nobody needs to wear a mask. It started with Spain, which has declared COVID into an endemic and said, this is going to live with us. Like, just deal with it. It's not a pandemic. It's an endemic. The disease will come and go. Like we had swine flu, we have had dengue and all that. Community transmission of these diseases happens every couple of years. You get, a large number of cases at a certain area, and then so on and so forth. So I don't know how true this statement may be, because the propensity and the inherent nature of coronaviruses to mutate, while we are happy that Omicron is very mild and basis on the number of people who have caught it, we are developing some measure of herd immunity, which is what vaccinations were attempting to do in the first place. But having COVID gives you a lot more in terms of natural immunity than a vaccine ever will. So, we are hoping that, fingers crossed, that this marks the end of the pandemic. But having said that, we have to be cautious. We cannot let our guard down. We have to take due precautions, because this virus can mutate again just as easily. And you may end up with a variant that, may spread as fast as Omicron, but still have, the severity of disease that we saw with Delta. So as of right now, based on what we have seen, we cannot afford to let our guard down. We cannot open everything up and hope for the best, that the worst is behind us, which we sort of have been hoping, but we should not take that chance right now. So that is all about Omicron. So I'll leave the floor up for questions, if there are any. I didn't want to go into too much detail because we all read up so much about it. But if there are any questions, I'll be happy to take them now.
Thank you so much, Dr. Adit, for such an informative session that you have given us. And we will be opening up for any questions. So it's a request to everyone who has joined in, because I believe that a lot more people might have like enrolled for it, but not have put in the, might not have got the availability to join it. So we have one question from Mahipal Singh. He is asking that, Dr. Adit, this question is to you, that he's asking how long it takes to recover from Omicron completely, and what are the post-recovery symptoms of Omicron, if you can answer that.
So Omicron, in terms of symptoms, like I mentioned, the most common symptoms are headache, severe body ache, and fever. Generally, in around 50% of cases, they are asymptomatic. They don't feel anything at all. But those who do have symptoms, these are what they present with. Fever lasts for a couple of days, may last up to 5 days at max. But body ache can persist for up to 2 weeks, in different severities for different people. It varies quite a bit from person to person. In terms of the long-term symptoms of COVID, you may have a persistent cough, a sore throat, a itchy throat, that may again persist for up to 2 weeks. We do not have data on the long-term implications of Omicron as of now, because it is a very recent variant, less than 2 months old. Like in Delta, we had data that it will cause long-term lung damage, organ damage. It causes formation of microscopic clots, which can travel about your body and harm your heart, your brain, and cause undue incidents. So far, we have not seen any such data with Omicron, because it does not progress below your throat, go down to your lungs, or affect your organs as such. But in terms of the long-term effects, a general sense of weakness. It takes time to recover from any illness, but we have seen faster recovery. Not a very long-term progression of symptoms. So generally, people tend to fully recover within 2 weeks. Hope that answers your question.
I think that answers the question. And it's just a general request to everyone who have joined into the session to keep on typing their questions and posting it across, and we will be taking up the questions as and when they are ready. question, Dr. Adit, from Mr. Kapil Mehta. How do you know at what stage to go to a hospital? Is this linked to symptoms or otherwise?
A very good and interesting question. So, in terms of people who don't have any comorbidities, we once again, asked you to self-monitor or, at least get under a physician's care for COVID. The parameters to monitor remain the same. We check your blood oxygen levels, we check your pulse rate, and a general, review of the symptoms of the patient. So if you're a healthy individual who, may not have any comorbidities, are fully vaccinated, I highly doubt that you may require admission in a hospital. But the danger signs, like I can tell you, if you become severely dehydrated, you may sweat a lot because of fever. Your oral intake may become poor. You may lose your taste of sense of smell. So don't eat or drink that much. When you start feeling dehydrated, your heart rate drops, your oxygen levels go down. That is a danger sign that we keep on asking the patients, please keep on checking your oxygen, your pulse. And you can just see a patient, a family member can just see and tell them that they are looking sick, and you can just consult a doctor. So in a case like this, I would strongly suggest, if you don't have a GP, log into Meradoc, talk to our doctors. They will be the best to guide you. Available 24/7 again without any cost. So they can come and consult a doctor. But the danger signs are obviously, in terms of severe disease, would number one be a fall in blood oxygen levels. So a normal person has an oxygen of around 98 to 100%. We keep a cutoff of 92 to 94 for healthy individuals. If it goes below that, it's best to seek medical attention. It may not be an admission, but just go to a nearby, either consult a doctor online or in person if you have one, or go to a hospital and get checked out. Seek medical advice as quickly as you can. Don't waste time, is what I would say.
Great. There's another question by Narsimha. I think that has been answered by Dr. Adit already, but still I'll go ahead and, for everyone's information, ask it. What is the isolation period for the ones affected with Omicron, Dr. Adit?
So again, a very pertinent question. Isolation period for COVID, as per the guidelines issued by the ICMR for the Delta variant, was minimum of 10 days of isolation. Irrespective of the symptoms you have, the virus has a life of 14 days. And after generally the 8th to 10th day, you stop shedding the virus. It means you stop being contagious. It's contained inside your body, it starts dying off. But in cases of Omicron, there has been a wide variation in what we have heard from different governments, like in the US and India. They say that if you don't have symptoms after 2 days, you are free from quarantine on the 5th day. While this is what the official, stand has been, as a doctor, I would still like to say, please do not step out, stay in quarantine for 8 to 10 days. If you do even step out and, you want to meet your family members who may be negative, always wear a mask, keep barrier protection there, wear an N95 when you're out and about, and, take due precautions. Having the virus once does not mean you cannot get it again. Again, a sense of complacency should not be there, that I've had, even I have had Omicron, I'll go out without a mask, that, I'm free from it. That is a big no as far as I'm concerned. So just take precautions for your safety as well as those of your loved ones.
Great. I think that answers your question, Narsimha. There are two questions asked by two different individuals, but just for the time constraint, I'll just merge the question and ask as one, Dr. Adit. So what effects Omicron might have on kids who are less than 5 years old, and also on pregnant women who are undergoing a labor process?
Okay. So I'll start with the kids first. I answered it a bit in the short talk I gave. So kids are highly susceptible to Omicron. As we have discussed, transmissibility is very high. You're shedding the virus everywhere. So kids are at high risk, especially because they don't have vaccination. Now, coming to the virus, the inherent nature of the virus. This is a virus that lives in the nasopharyngeal space. The space between your nose and your mouth is where the home of the virus is. Kids, by virtue of being kids, have a physically smaller space where the virus can occupy, so it cannot multiply as such. Having said that, it does bring about the same symptom. Like your kids may have high fever, may have flu-like symptoms, but by virtue of having a lesser space for the virus to multiply, they are inherently quite safe when it comes to severity of disease. But certain kids, as we know, are susceptible to illnesses. They have immune disorders, so though that population has to be kept safe. But the symptoms are more or less similar to what adults get, and by virtue of not being vaccinated, we have now seen increasing number of cases in children as well.
Okay. Another very, very important question by Mr. Jha. He's saying that he's 59 years old and is a diabetic patient.
Yeah.
So he's asking how he can get a booster dose now, presently, since it is open only for 60 years plus.
That is an interesting question, but I have it on good authority that the government is going to open it up shortly for individuals above 45. We have talks with Niti Aayog and all those government bodies, and everyone is pushing for boosters. A section of the community, or our healthcare fraternity, has questioned the need for booster doses in the first place. But based on data available with us, that the studies that have happened with Pfizer and Moderna in the US, is that a booster dose increases the antibody count by up to 1,000%. Immediately after a dose, it may start tapering off. Maybe a month after it, but in terms of short-term boost, that's exactly it. It's a booster dose. So while we cannot offer booster doses to those below 60 right now, but I am fairly certain that pretty soon that is going to open up.
Okay. Another question, which is asked by Anshul Rai: if I'm vaccinated, am I protected against Omicron completely?
Depends on what the definition of protection is. Like I said, vaccines cannot protect you from getting the disease. That is a very big misunderstanding that people have, that I'm vaccinated, that means I cannot get COVID in any form or any variant. That is absolutely not true. While it does, protect you from getting it, but breakthrough vaccinations are quite common, especially with Omicron. Fully vaccinated individuals are getting the disease, but it reduces the severity of symptoms by a fair margin, by up to 90%. And what the vaccine studies have shown, that it reduces mortality in healthy individuals by up to 100%. So, wherein there was no certainty among us, with the wave last summer during May, June, July, it was affecting everyone, be it a youngster or an elderly person. We have seen healthy people, who unfortunately lost their lives due to this. So while vaccines may not prevent you from getting the virus, they will reduce the extent and severity of the disease by a fair margin. So that is why vaccines are important. They are the definitive thing we have to do to contain this pandemic.
Okay. There's another question asked by Vijay Kumar. My dad had the second dose in August 2021. So basically, he has written quite a lot there. He just wants to know that he already had gone through a mild COVID attack in the first week in January. He was okay after that, and he got self quarantined. He's all right now. Is it a good time for him to take the precautionary dose which is available in the market?
We advise taking the precautionary dose at least 3 months after your positive test for COVID RT-PCR, because the disease itself causes you to gain quite a bit of immunity. Your body starts producing antibodies, which is the same as what a vaccine does. The vaccine introduces your body to the virus, that this is something new, and the body says, okay, fine, if I meet it again, I'm going to try and build something to fight it. So when you actually had the disease, your body has already done all that before the vaccine has come into it. So while what happens is you start losing the immunity, you start losing the antibodies, and when you use it is when you get in contact with the virus. All of us, by now I'm pretty sure, have had some contact with Omicron, whether or not we accept it. But that is where the antibodies come in. Antibodies are built and they have to be consumed for them to go down. So every time your body, contracts Omicron, the antibodies fight it, try to throw it out of the system. So by virtue of having COVID, you have already built a natural immunity. So that is why we recommend taking the booster dose only 3 months after, getting the disease.
Okay. I think that answers your question, Vijay. Moving on to the next question, Mr. Kumar is asking that is continuous dry cough, running nose, and throat pain the symptoms of Omicron, or are there any other symptoms besides this?
These are a few symptoms of Omicron. These are the symptoms of seasonal flu. These are also the symptoms of seasonal allergies. We are moving into spring, where a large amount of pollen and dust and pollution is in the air already. So these symptoms are quite common across these illnesses. So while if you suspect that you have Omicron or COVID in any form, please get a RT-PCR test done. That is the gold standard, and it's going to help you fight off the disease. So symptoms can be shared between illnesses, but from experience that we have gained during Omicron, runny nose, headache, and fever are the three most common symptoms. Coughing plus minus, it may or may not be there. 50% of patients don't have any symptoms at all. By virtue of having one member test positive, they actually find out that we are positive as well, but we don't have any symptoms. We just quarantine at home, and we're perfectly all right. So while symptoms can be common with the flu, with seasonal allergies, they can be Omicron as well. So if you have any doubt, just get tested.
Great. Another question from Mahipal Singh. He is asking once again that is there any idea as to when we can get a permanent vaccine for all variants of COVID-19?
A very difficult question to answer because, like I said, the virus mutates quite a bit. From Delta to Omicron, Omicron has a total of 52 mutations. Mutations mean basically changes to how the virus is built and how it interacts with the body. So it becomes very difficult to specify if one vaccine will cover all current as well as future variants. While with the advent of mRNA vaccines, which unfortunately are not available in India, it allows us to change and mass produce the vaccines on a large scale. So in an mRNA, if I find a new strain which the vaccine is not effective against, I can tweak it, reformulate, do another trial, and have it out in the market in a span of as little as 6 months, like we did last time. But the good news is that the current vaccines do confer some level of immunity against Omicron as well. While it may not prevent you from getting the illness, but in terms of severity and mortality, it does work. So as of now, the current vaccines we have are working well. We cannot say with certain about the future. We can only be hopeful that with Omicron and weaker and weaker variants that are spreading have high transmissibility and less severity, we can finally say goodbye to this chapter.
Okay. Vidhi is asking that is the Delta variant now a past thing, or is it still much there? Symptoms of Omicron is similar to Delta variant, or has something else to do with it?
Very good question. So, like I said, Delta to Omicron ratio right now in India, I'm not talking about just Delhi, is 90:10. So, while that means that 90% of patients have very mild illness, 10% of them are, they have the Delta variant. Again, by virtue of having a high vaccination rate, those people who have Delta are also protected. But, the severity of symptoms, Delta does migrate down, into the lower respiratory tract, and that is where it wreaks the most havoc. From day 8 up to day 12, it starts messing around with your lungs, your oxygen saturation starts dropping, you become oxygen dependent, it causes widespread organ damage, causes microclotting and all that. So we have become very complacent in sense of dealing with Delta. We cannot ignore it for now because it is still there in the community. People are spreading it about, though not as much as maybe Omicron. But right now, in terms of hospital admissions purely on patients requiring oxygen, 50% of patients in hospital beds right now are suffering from Delta as opposed to Omicron. So Delta, we cannot ignore it right now. We cannot say that we are done and dusted with it. It's no longer relevant. It is still there very much in the community, and we cannot let our guard down when it comes to it.
Okay. Thanks a lot, Dr. Adit, for answering that. And another question by Pradeep. He's asking that he got fully vaccinated in July, but he has been tested as COVID positive in January now. But he's fine. And what are precautions he needs to take going forward?
So precautions are purely from a recovery point of view. If you did not have any significant symptoms, you had very mild symptoms, just start building your body back. In fighting with any viral disease, be it a common cold also, your body loses out quite a bit in terms of immunity, in terms of strength. So, having a good balanced diet, plenty of supplements, you may have vitamin B12, vitamin D supplements, which have, clinically shown to, help fight and help you recover from COVID. So that is it. Apart from, if unless you have any long-term symptoms that, are nagging and, are not going away, just a healthy balanced diet, plenty of exercise, slowly ease back. One thing which, we always recommend to patients, you may have been running marathons before COVID, but, just start out with a brief walk once you recover. Don't go running the next day. You don't know what the effect has been on your body. So just slowly ease into your exercise routine. Don't go to the gym straight away. Baby steps towards getting back to a full health. That is the way to go.
Great. There's one question that I missed out, so I'm scrolling back to the charts. One question by Surya Chaturvedi. He's asking that how do you differentiate between normal flu or COVID?
Very good question. So, in terms of severity that we have seen, flu may or may not. Flu is again a virus. Influenza is again a virus. COVID again a coronavirus and virus. So, in terms of symptoms, we have seasonal flus. You have a runny nose. You have cough. May or may not be followed by a lot of mucus formation. May or may not be associated with fever. What we have seen with Omicron, the headaches, fever, and the body ache, they are the three distinguishing factors from the normal flu in terms of the severity. Like Omicron patient, we have seen if the symptoms are there, they feel like they cannot get out of bed at all, which is very very rare when it comes to a normal flu. So while some, the name of the symptoms may be the same, the severity matters quite a bit. And with clinical experience dealing with patients, you can immediately identify or distinguish between the two. But if you ever feel like you have any symptom, it may feel like a cold, I would strongly suggest you get tested, because prevention is always better than cure. So if you can take better care and start treatment for COVID right away, it works out better for you in the long run.
Great. I hope that answers your question, Surya. And moving on to the next question by Praveen. Praveen says that he has now recovered from COVID, but still his cough hasn't gone. It has been a month since he got recovered. So, what could be the probable reason for that?
So again, this is something that we called as long COVID. This was especially pertinent after Delta. While we are not sure which variant he had, a cough is a nagging cough. It can last upward of 3 months, which what we have seen in previous cases. So while you may not be contagious, people obviously get scared when you cough around them. You may not be contagious, but why don't you consult a doctor? We'll start you on some medication for that and help you get rid of it. We may require a few tests and all, just to check if maybe it may have been Delta, it may have affected your lungs a bit. Something as simple as an X-ray or a PFT can help us determine that. But we do have some treatments for you. So I would recommend just go online, have a chat with a doctor, they'll help you out.
Praveen, I hope that answers your question. And we are waiting for more questions to be posted by people. And yeah, so in the meantime, as Dr. Adit has already told you, it's a complimentary services that we are extending to everyone in this, in these treacherous times. And that is why you can directly get connected with Secure Now. All you have to do is share your information, share details like your mobile number, name, and a couple of other things which Secure Now folks can tell you about it, right? And we can register you from the back end. Plus, you can start using our app, and you can ask more questions. Because of time constraint, we will have limited bandwidth there. So as and when you guys want to consult a doctor, you can always reach out to us through that. So I got another question by Vijay Kumar. Uh, so basically, Vijay Kumar is asking that he has heard that mostly the Omicron effects are very mild. Does it mean our vaccination working they are working fine for Omicron variant, and they are not working as well for Delta variant?
That is a difficult and tricky question. So the answer is yes and no. While the vaccinations are working, Omicron, by its inherent nature, has a tendency to cause fewer severe symptoms in individuals. As I told before, Omicron multiplies in the upper airways. It stays within your nose and your mouth, so it does not spread down to the lungs, which is where Delta was, causing the vast majority of issues with patients and causing permanent lung damage and scarring and whatnot. So Omicron, by virtue of its mutations, has milder symptoms which generally remain to your nasal and your mouth area. So in terms of Delta, there has been a drastic reduction in number of admissions, if I may say. We are getting 2 lakh cases, and even if 10% are Delta, that means 20,000 people who would have been susceptible to severe disease, as we had seen last time. So vaccines do work. People are flying through with minimal symptoms, even if they have Delta, and it is only amongst the elderly population who are weak and those who have significant comorbidities. Maybe have heart disease or other underlying diseases. They are the ones who are requiring more medical attention. But even though Omicron we may call it a milder symptomatic variant, but vaccines are helping in both of them. So I hope that answers your question. So vaccines do work. Any variant you have, they will protect you.
So Vijay Kumar, I hope that answers your question. And we still have 10 minutes left. So if anyone wants to ask any specific question to our specialist, Dr. Adit, please go ahead and type it in the chat so that we can, answer you. Dr. Adit, I think we have answered all the questions that the people were asking. I would just ask once again, is there any other question? Hemant is saying something. So Hemant is wanting to know that can we expect through any studies or researches so far that COVID is an endemic and by this year itself it will end, or we might get new variants in continuation. So he's just asking that, is there any supporting document or study which says that?
We can only hope right now, because while we are optimistic that by virtue of everyone being vaccinated and herd immunity being built up, the COVID virus will become endemic in certain regions, where people or by genetic makeup may be more susceptible to it. It may the difference between a pandemic and an endemic is a pandemic is something that can spread around the globe. Endemic is a disease that pops up from time to time, while it may be just as transmissible, just as virulent, may cause the same severity of symptoms, but it is not there all the time. So if we take adequate precautions, we quarantine the patients, have treatment protocols in place. So that is the primarily technical definition of an endemic. While it keeps on mutating, the virus, it's very unpredictable. Even within Omicron, we have now got a new variant which is BA2, and it has continued, and it has started like Omicron replaced Delta. The BA2 variant has now replaced Omicron, the original one, in India as well. So now more than 50% of cases are those. It would be fair to say that it's an even weaker variant in terms of symptoms. COVID cannot be called weak. We can just say it's a milder variant causing milder symptoms. So the virus is very inherently unstable. It keeps on mutating. While we cannot, with certainty say that this is the end of the pandemic, we can now start returning to normal lives, it would be foolish for us to, let our guard down. We are hoping for it that it will happen, hopefully by the end of this year, we would be done and dusted. We'll be able to go out, we'll be able to travel. We may not have to wear a mask in public, But till that happens, we should not let a guard down, that everyone has sabko ho hi gaya hai COVID. That cannot be the attitude. Once we go back, once we start reopening the country again, with the limited lockdown that we've had. So again, precautions are key, and again, vaccination. These are the two things that will, are a short way to end this pandemic. We cannot certainly say that this variant is the definitive one. It is the last one to come. There's not going to be anyone after this, but we can be, cautiously optimistic about it.
Great. I hope that answers your question. There's a very interesting question which came from Biju Babu. So
Yeah.
I feel that a lot of us might be, having this question. So thanks a lot for asking that. So he's asking, how can I protect my newborn child from COVID? It is very difficult for me to just isolate her in a room every time.
See, a newborn baby, you cannot isolate a baby. Like, they require constant attention and care. How you protect the babies is protecting the baby from those around it. Yourself, your family members, your wife, your parents. So if you take adequate precautions, you reduce your chances of getting the illness. And again, vaccinations, masks, all these things, like I mentioned, they do help. So it is all about you, how you can take precautions to help those help protect yourself and your family members from getting it. So in households who have very small toddlers or children, I would suggest maybe more than adequate precaution should be taken to prevent the children from having it, because newborn has poor immunity. Like, let's face it, we'll be kidding if we say that newborn बहुत छोटा है, nasal passage is not there, the virus will not do anything. But they are quite weak in terms of immunity. That is why we have to give them vaccinations by the age of 5. Continuously, we give them vaccinations. So your protection is what going to play a major role in the children's protection. So if you can save yourself, your child will also be safe.
Okay. Another question is that who is at the higher risk with Omicron variants? Like age-wise, can we bifurcate that?
So age-wise, I would say those above 60, who we call the elder population of the country, and those with comorbidities. Now, comorbidities, can be something as simple as having high blood pressure. You may be taking certain medicines to, reduce your blood pressure, or, being diabetic, even though it may be under control. But like I said, the virus, even Omicron, it messes with the inherent systems of the body. You may not feel it when you have it, but like I said, if I go down into technicalities, Omicron causes the muscles to leak out potassium into the blood. This is what is causing severe body ache. Your muscle starts aching. Potassium, when it goes into the heart, it causes the heart to pump faster. It causes palpitation. You feel your heart is racing. You start sweating. And again, working on the same mechanism, it prevents insulin from getting absorbed properly. It leads to higher blood sugar levels. So all these things, on a microscopic level, it keeps on messing with the systems. A healthy individual is able to adapt quickly. His body is able to recover, has adequate bandwidths in place to recover. But someone who is already on the borderline for an illness, or is suffering from it, or is on medication for an illness, it takes the system and it goes takes it for a toss. It goes haywire, and your sugar level starts spiking. If you have heart disease, you may notice changes in your ECG. So those people who have comorbidities, and the elderly who, by sheer nature of aging, recover slowly from these issues. So while it may only present at to us like a fever or a body ache, there's a lot of things going on in the background that we normally don't know and we don't test, but we rely on our body to fight it for us and bring it back to normalcy.
Okay. So Surya is asking Dr. Adit that his wife had a fever last Friday, and then he also had a fever, a normal kind of a fever for 2 to 3 days. Then he got severely affected. Then he's been running high on fever for the past 1 day. He's just asking that how effective it would be to have the teleconsultation and taking the medicine after doing that teleconsultation.
It is very effective. Speaking to a doctor via video call or a phone is the same as going to a clinic. While he may not be able to use a stethoscope to hear your chest out, but that is not the symptom you have right now. By just listening to your symptoms, I would say that you're at a high risk or a high probability of having COVID. And like you said, your wife had the symptom, and you called it a normal fever. There is no such thing as a normal fever. If you have a fever, there's something is not wrong. So it's definitely not normal. So by sheer description of the symptoms you told me, I would say that you are at high risk. But to take a deeper dive, why don't you talk to a doctor right now? Just try, go to meradoc.com, call a doctor up, have a consultation. They will advise you. So it's not just about me telling you that you may have COVID, you get RT-PCR done. It is also some reaffirmation that you require that everything's going to be okay. Have at least 2 to 3 liters of fluids a day. Take some medicines for if your fever breaks. If it doesn't, please call us back again. We'll suggest some alternatives. So things like that. So that is something only a doctor can do. You may hear from family that एक डोलो खा लो, have 4 dolos a day, everything will be fine, it's just a cold. Have this anti-allergic, have this supplement, have this tea, have that. But a doctor is what brings it all together. You may say that I'm having it perfectly fine, but there may be certain specific needs that you have. You may be sweating a lot when you have fever. That puts you at high risk for dehydration. You may lose your taste, you may not be eating, then that puts you down for malnutrition, losing a lot of protein mass. So a doctor is best able to guide you for that process. So just pick up the phone, consult a doctor. As easy as that.
Another question by is
Sorry, Abhijit, I can't hear you.
Can you hear me?
Yeah.
Yeah. So another question by Kapil Mehta. After how many days of being tested positive for COVID?
Abhijit, I lost you at the end.
Can you hear me? Dr. Adit?
No.
Dr. Adit, am I audible?
Yeah, now I can hear you. Yeah.
Another question by Mr. Kapil Mehta. He is asking that after how many days of being tested positive for COVID, can we go outside the house with a mask, of course?
Worst case scenario, what is generally acceptable is you go out on the 10th day. But what governments around the world are advising right now, that if it has been 3 days since your last fever or cough, or to put it more simply, if you have been asymptomatic for 3 days, feel free to go out. So that generally happens between the 5th and 8th day, from what we have seen in Omicron. So if you absolutely have to step out, you can step out after the 6th day if you don't have any symptoms, and please do wear a mask. Preferably N95 or a surgical mask. So ideally it should be 10 days, but if you do have to step out, you can do it after the 6th day, provided there are no symptoms, that is.
Another question by Vidhi. We just expedite the process now. We just have last 10 minutes, guys. So keep on posting your questions.
Abhijit, I really can't hear you. It's quite low, your volume.
Yeah, Dr. Adit, can you hear me?
Yeah, now much clearer.
So I think I'm facing some kind of a bandwidth issue. So another question by Vidhi Agarwal. She's asking that, does Ayush treatment effective for the Omicron?
So Vidhi, I cannot, being an allopathic doctor, I cannot comment on Ayurvedic treatments. But based on what I have read, there is no definitive study that says, that Ayush medicines, Ayurvedic, homeopathic, have merit. Having said that, please feel free to use that, but do consult a doctor in case your symptoms worsen, because these medicines have not been tested truly. Like when we talk about testing medicines, testing vaccines, we do it on lakhs of people. We've had products being launched under the Ayurveda banner. They tested them out on 1,000 people and said, this is a cure for COVID. And we are the first company in the world, approved by government of India. I'm not going to name the brand, but we have definitive cure for COVID. This will treat you. So while I cannot comment on the efficacy of these treatments, We do have options in allopathy. Like there is no definitive cure for the virus, but we do have treatments available which can reduce the symptoms, reduce progression of disease. Even if you do get into severe disease, there's a lot of treatment modalities depending on your condition that you can take. So do consult a doctor for that. Feel free to take any homeopathy Ayush that you any medicine you believe in. But if you don't feel it's working, or if there's any progression of symptoms, I strongly urge you to talk to a doctor, or get online on Meradoc and talk to one of our GPs right away.
Okay. Another question is that if a person has started feeling better post taking the antibiotics, Dolo or some other anti-allergic, is there any other special need to go for a test for COVID, or one should just stay the way it is?
So like I said, if you think you have COVID, you may not have been tested. But if you isolate properly, while first of all, my first comment should have been that please get tested. It helps everyone, and it helps researchers also gain data. But if some people prefer not to, so if you don't get tested, you suspect you have COVID, just follow the isolation and quarantine program. So if you have been asymptomatic for 3 days, you took all the medicines, you did everything right, you are asymptomatic for 3 days, wear a mask, go out. As simple as that. Uh, just bear in mind, you can test positive for a COVID test for up to a month after the illness. That is because the test cannot distinguish between a dead virus and a live virus. So even after you are done with COVID, the 14 days of the viral life has ended, the fragments of dead virus remain in the body, and those can test positive on RT-PCR.
Great. Thank you so much, Dr. Adit. Surya, your next question, I can answer that. He's asking that, can you please share the link for Meradoc app? So just for the information purpose, right? So we are in the process of making a native mobile application that is already under, a user.
It will come out. The app will come out next week. Meanwhile, I think Abhijit can share the link
Definitely
to the website in the chat, and please feel free to go there and log in. We have easy access protocols in place. So even if you have elderly parents who may or may not know how to work around a cell phone, we have an IVR system wherein if your phone number is registered, call our toll-free number, just press a button, and your appointment is booked. And in something which I have not seen in the space so far, the doctor calls you back. It's one of a kind thing. The doctor will call you back to inquire about your health and issue you a prescription. So it is, we have tried to make it as easy to use for everyone. So as simple as calling a phone number to get a consult. You don't necessarily have to log in or you have to download the app. So just try it out. We have different modalities of connecting with a doctor, all easy. So Abhijit will share the link and the data.
Definitely, Dr. Adit. We can get in touch with Secure Now folks, and all the information to our viewers can be shared post this call itself. So another question by Biju, he is asking, how much time should someone have to wait for vaccination if someone get COVID positive now?
The definitive answer is 3 months. Provided you are eligible for the third dose. As of now, the government has kept it quite restricted in terms of who can get the booster shot. So it is either you are either needs. Actually, you have to be 60 plus and have some comorbidities. You have to be diabetic or hypertensive or have any other illness and be above the age of 60. And also 9 months should have passed since you had your second dose. So, quite a short number of people. It's a very small list of people who qualify for it right now. But having said that, once you become eligible, if you do get COVID, wait at least 3 months to get your booster.
Great. Another question by Manoj is that can booster dose be different from the first and the second doses? That is, if first and the second was Covishield, can booster be Covaxin or any other way around?
So different countries have tried it out. There have been trials. When there were some issues with AstraZeneca vaccine in UK, they mixed the doses. They gave people who had first dose of AstraZeneca, then they got an mRNA vaccine like a Moderna or a Pfizer, and the results were good. So mixing of vaccines did show some good efficacy. However, large-scale trials for those have not been happened. And even in the Western world, in USA and all those countries, they are giving booster shots of the same vaccine that you got. So there is not enough data to say that, definitely a third dose of a different vaccine is going to be better. So the safest thing right now is to get it for the same dose. We do expect that, vaccination booster dose is going to become a norm rather than an exception. You may have to get a booster every year. We may develop new techniques to, tweak the vaccine. Like we get the flu vaccine, it has different strains. So that is why it is for a particular year only. You get a 2020, 21 or 21, 22 flu dose. So something similar is going to happen for COVID, where they may tweak with the vaccine a bit. So, keep on providing you immunity for the variants that are going around at that time. So to answer your question in short, as of now, there is no data to show that, a different vaccine will be better. So that is why the government has proceeded to, have the same one for the third dose. So I had through 2 doses of Covishield as a healthcare worker. I got my third dose right now as soon as it opened. So 3 doses of AstraZeneca for us.
Okay, I think that answers your question, Manoj. Moving on to the next question. After how many days of delivery, breastfeeding mothers can take the vaccine?
So breastfeeding mothers can take the vaccine immediately after delivery. Okay, provided they have not had COVID in the past 3 months. The advantages, I'll tell you the advantages and disadvantages. A disadvantage is obviously, some reactions do happen. Some are more severe in some people than in others, if it's a newborn baby, it requires mother's care all the time. So for a mother to get fever or, be on rest for 24 hours can sometimes be difficult, especially in the urban areas where we have nuclear families and, both husband and wife are working. So, the baby requires some extra care. Now, having said that, what we have noted is that the antibodies get transmitted through the breast milk for the babies. So when the mother gets the vaccine, she develops some antibodies. Those are passed on to the baby through the breast milk. So that is why we strongly urge, mothers who are breastfeeding to get the vaccination done. It gives immunity to your babies as well.
Great. Thank you so much, Dr. Adit. Are there any other questions? I hope we have answered mostly all the questions that have been posted by the people.
Yeah, if any more, please feel free. I think Abhijit can share my email ID with all of you guys. I'll try and answer as many as I can. And just share any queries, or if any doubt, just call our doctors, they will answer your queries or questions.
Okay, thank you so much, Dr. Adit. So I think we are right on time. So this has concluded the session. And as Dr. Adit has already mentioned, I will be sharing the email ID. You can always write back to us. You can also register and talk to our doctors, right? And so feel free to get connected with us. And we are really looking forward to, towards serving you guys better in future.
Yeah.
So thank you so much, Secure Now, for arranging this session, awareness session with all your employees and plus all your customers. And I hope that this link will be shared across with everyone who requires our assistance. And we are always there for you. Thank you so much, Dr. Adit, for joining.
Thank you, everyone.
Thanks a lot, guys. Bye-bye.